Kenya's health sector has received a significant funding boost in the 2026-27 financial year, with the government increasing its allocation by 39.1 billion shillings. The sector has been allocated 177.2 billion, up from 138.1 billion shillings in the 2025-26 financial year. The additional funding is expected to accelerate the rollout of universal health coverage to enhance primary healthcare services and improve access to treatment for chronic and critical illnesses. The allocation will also support key health programs aimed at expanding access to quality and affordable healthcare for all Kenyans. On the other hand, health stakeholders maintain that despite this increase, Kenya is yet to meet the 15% Abuja Declaration mark. Is NTV's Helen Aura with the details.
The health sector has emerged among the biggest beneficiaries in the 2026-2027 national budget, with allocation rising from 138.1 billion shillings to 177.2 billion, an addition of 39.1 billion shillings. Primary Healthcare Fund has received 19.1 billion in the current financial year, up from 13.1 billion Kenya shillings in the 2025-2026 fiscal year. Emergency, Chronic and Critical Illness Fund will receive 3 billion Kenya shillings, a huge drop from the 8 billion which was allocated in the previous year. The government has also set aside 18.5 billion shillings for the Global Fund program for HIV and AIDS, malaria and tuberculosis, an addition from the 17.3 billion allocated in the 2025-2026 financial year. 6.4 billion Kenya shillings has been set aside for vaccines and immunization programs for children, an increase of 2.4 billion Kenya shillings from the previous budget year. 8.6 billion for universal health coverage staff has been allocated, an increase of 2.4 billion Kenya shillings from the 6.2 billion allocated in the 2025-2026 financial year.
1 billion for construction of a cancer center at Kisii Level 5 Hospital. 300 million to strengthen cancer management in Kenyatta National Hospital. And 150 million for the expansion of comprehensive cancer center at Kenyatta University Teaching Referral and Research Hospital. These measures will expand diagnostic and treatment capacity across the region.
Despite the increase, Kenya remains below the target set by the Abuja Declaration, a commitment adopted by African Union member states in 2001, which calls on governments to allocate at least 15% of their national budgets to the health sector.
Healthcare is still not a national priority. It's not been given the kind of weight that is required. If you consider the global agreements that Kenya has signed, where we need to be spending something like 10 to 15% of our GDP on healthcare.
Additionally, the legacy debts inherited from the defunct National Hospital Insurance Fund, NHIF, is about 30 to 33 billion Kenya shillings in unpaid claims owed to hospitals and healthcare providers. Today, Treasury Cabinet Secretary John Mbadi stated that they will clear debts below 10 million.
To ensure reliable supply chains and strengthen human resources, I am proposing 20.9 billion for Kenya Medical Supplies Agency, KEMSA, 3.1 billion for the Kenya Medical Research Institute.
To strengthen the workforce, medical interns will receive 9.3 billion Kenya shillings. Community health promoters will receive an allocation of 3.2 billion for medical insurance and stipends.
At least they increased by 6 billion. From 13.1 to 19.1, but we are still doing below, actually less than 50% of what is expected.
While stakeholders have welcomed the increased allocation, they maintain that Kenya must significantly raise health spending if it is to achieve universal health coverage. Helen Aura, NTV.